Hello, everyone. My name is Eniola Disu, and I'm making this public health campaign video on behalf of myself and my group mate Vivek Gadhavi. And this is our public health campaign. And the topic we are focusing on is rural health in Illinois. And so I'm going to be talking about rural health in Illinois. And so our theme is this. It's a beautiful theme: from prayer to peak, health we seek. And this just depicts the fact that everyone seeks to walk in good health, especially those in rural areas. So, um, prayer to peak signifies the undulations and the mountainous regions, as you can see right there, um, that are present in most rural areas in Illinois. And so from Prairie to peak, health we seek. And so right here is a map that is showing the rural areas in Illinois. As you can see right here, it looks as though 80% of areas uh, of counties in Illinois are rural, especially right at the southern area. So in southern Illinois, there are so many counties that are rural areas. And this was gotten from the Illinois Primary Healthcare Association. And they defined a rural area as a county that is not part of a metropolitan statistical area, which they call MSA, as defined by the US Census Bureau. Or rural areas could be defined as a county that is part of an MSA but has a population fewer than 60,000 people. And so all the green areas you see here depicted in this map of Illinois are rural areas. And so we are focusing on the rural areas in Illinois. And so my teammates and I were able to research and come up with top challenges that rural areas face, especially in terms of their rural health. There are rural health challenges that these rural areas face. Top on the list is limited access to health care. You know, health challenges in rural areas can be diverse and complex, and it's oftentimes a combination of socioeconomic, geographic, and infrastructure related factors. And so addressing these challenges requires a holistic approach that considers the unique needs of rural communities. And so here stated as some of the health challenges that rural areas face. And then I'll be talking about the solutions that my my team um, Vivek and I have come up with and that we will be implementing as well. And so um, the number one rural health challenge is limited access to healthcare. These areas have little or no healthcare systems, due to the fact that there are shortages of staff, medical personnel, doctors, dentists, you know, physical therapists, name it. So, um, and also, uh, healthcare centers are also very few in rural areas. And these are challenges that these rural areas face. Another one is lack of proper health education and awareness, due to the fact that there are very limited resources available in these areas and even limited transportation, which is also a challenge as well, and so these areas don't have as much health education and health awareness like other counties do. And also health insurance coverage is quite limited in these areas. However, the great news is that there are solutions to these rural health challenges. There are also others like, you know, most rural areas have lots of aging population because the elderly ones, the seniors prefer to stay in rural areas away from the hustle and bustle of metropolitan areas. And so these places are filled with um the aged population. And as we know that, most elderly people have a lot of diseases and chronic illnesses that they face. And the working population is fewer in rural areas as well. And so here are the solutions that my public health campaign, my team, Vivek and I came up with. And so these are we came up with three major SMART goals that we will be working on. And the first one is telemedicine, and this is gonna solve the problem of the is gonna address the problem that has to do with access to healthcare. So if they can't you know physically go to hospitals or meet with physicians, then telemedicine is a solution to it. And so we intend launching a telemedicine program for rural communities in Illinois, addressing health insurance plans, by providing virtual consultations via Zoom and, to at least 50 patients per month. And so telemedicine is a great, great solution to the problem of access to healthcare. And so, um, in addition to this as well, um, so we're gonna also include wellness promotion, wellness promotion. And so we're going to implement rural health community-wide wellness programs that are going to focus on nutrition and physical activity with the aim of increasing the percentage of residents again engaging in regular physical activity, you know. And so um, and this will be done by developing and promoting wellness initiatives, by providing nutritional education and addressing lifestyle related health issues that are prevalent in rural areas. Like I mentioned previously, most rural areas from our research um, are are filled with people who are elderly and most seniors, and so they don't really engage in so much physical activity as the younger population. And so this wellness promotion is going to make an impact because we're going to be encouraging the the population in rural areas, on you know physical activity and healthy nutrition, balanced diet, you know, and just promoting wellness initiatives generally. And also, thirdly, um, our goal is also to um, execute a rural health education program that is focused on obesity. As we know, when people are sedentary and don't have as much um, don't eat healthy, and if they don't exercise and they have little or no physical activities, then obesity sets in. And so we're going to be executing a rural health education and awareness program that is focused on obesity, and the aim is to decrease the incidence of obesity by 10%. And so we're going to do this. The action plan is to develop educational materials, conduct workshops, and involve local healthcare providers. And we believe that these initiatives and these solutions will, go a long way in curbing the challenges that the public is facing in the rural areas. And so addressing health challenges in rural areas oftentimes requires collaboration among government agencies, healthcare providers, community organizations, and residents. And so tailoring these solutions to the unique needs and circumstances of each rural community is essential for achieving meaningful and sustainable improvements in rural health. And so we will be implementing all these, and we trust that we will be able to make great impact. Um, and we believe that by you listening to this, you will also benefit from the solutions that we've shared. So thank you for listening, and do have a wonderful day.